The federal government recently announced the disbursement of 32.9 billion naira meant for the Basic Healthcare Provision Fund for the primary healthcare systems around Nigeria. What does this mean for the healthcare system, and how do we take charge of this healthcare system apart from ensuring accountability and transparency? Good evening. Welcome to Sound Health on Lagos Television. I am Olasunbo Modupe. Stay tuned. The conversation begins after this break.
Kamal will die at 49. Lucy will die at 52. Ashley will die at 57. Fatima will die at 59. Ethan will die at 63. A privileged few will be healthy enough to live sometimes decades longer than others, particularly those with access not just to healthcare, but resources like housing, education and jobs. This is what health inequity means. To change this, we need to be all for equity.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening to share his expertise on the recently released Basic Healthcare Provision Fund is Barrister Ayo Adebusoye. He is the chairman, Public Health Sustainable Advocacy Initiative, and he is going to tell us all what we need to know about this fund. Good evening, Barrister Ayo Adebusoye, and thanks for joining us.
Good evening, Sumbo. Good evening, viewers.
All right, to start with, let us know what exactly is the Basic Healthcare Provision Fund. It appears that most people did not even know about this before the announcement by the federal government.
Yes, the Basic Healthcare Provision Fund is actually a very important part of the National Health Act 2014. It was constituted there, where it was actually statutorily provided for that 1% of the consolidated revenue fund of the federal government would go towards the Basic Healthcare Provision Fund, would constitute a Basic Healthcare Provision Fund, which would be linked directly, which would support, one, a gateway of the primary healthcare facilities nationwide. So we'll be going through the National Primary Healthcare Development Agency, and also the National Health Insurance Now Authority for the health insurance gateway. And then there's also another provision, small provision, like 5% of that for emergency preparedness. So the most important thing is that it's actually meant to catalyze basic healthcare provision in Nigeria. So, but even though it was, because you may remember the National Health Act, even to get it going, enacted, it took a long time, a lot of advocacy from civil society. And then after that, we actually took a long time before we started to even get it operationalized. That means before the fund was even made into the budget. And that was like, it took a lot of 5, 6, 7 years. And we thank God for a lot of advocacy from health advocates, civil society, and the legislature, because this was the one time, and it should go on record, during the time when Senator Dr. Larry Tejo was the chairman of Health Committee, Health Committee in the Senate. He actually spearheaded with the other members of legislators to ensure that there was a provision made, so about 50 billion or so, if I can remember well, for the budget, even though interestingly enough, the Minister of Health had not even made that provision in the then budget then. But that was one excellent view, an excellent use of Senate budget padding. So they actually padded the budget properly, because people forget that the National Assembly actually is the entity that actually has the power of appropriation. So when they do things correctly, like in this case, this was an example of where they actually did this correctly, where they actually made sure that, as per in furtherance of the law, the National Health Act, Basic Health Provision Fund provision was made available in the budget. Because if it's not in the budget, nothing will happen. And so since then, we've had it in the budget. There have been some, glitches. I think it's now been from what they mentioned, about 3 disbursements have been made. Sometimes there's been delays, especially with regards to the basic healthcare provision guidelines. Sometimes they have, because another thing, they have to be guidelines in place. Sometimes they revise the guidelines. So no, this is like the third big tranche disbursement, and it's 2.9 billion naira, which will go to about 8,000 private healthcare facilities, and of course the health insurance gateways in each of 36 states and the FCT. So it's quite significant. It's supposed to catalyze. It will not take care of all our health issues, but that's supposed to be at least some seed fund to catalyze, because that basic healthcare provision fund, as it goes to the primary healthcare, through the primary healthcare agencies at the state level, it's supposed to take care of basic things, operational running of the facilities. It's supposed to take care of health worker issues, some of their needs, like its upkeep of the facility. So in theory, this is something that could actually bring some level of infrastructural development of the primary healthcare centers. We have about 30,000 estimates, about 30,000 private healthcare facilities. So this will only take care of about a quarter of them. But at least that would be an example. If we could actually make sure that at least we even have a quarter of that, of those PHCs, in a actually appreciable state of function. Because part of the challenge we know is that the primary healthcare facilities, many times, they are not functional. The buildings may be there, because over the years, we've had various interventions that support the primary healthcare system. First one is the local government, which is actually constitutionally mandated to actually provide basic health care. And so a lot of the primary healthcare facilities are even in local government facilities. Sometimes some local government authorities were actually primary healthcare facilities before they became local government centers. So the local governments are primarily meant to take care of the basic healthcare provision, primary care. Then the states also have their responsibility. But many times, we see that the states have to take over that role. But that is actually not sustainable. The local governments are supposed to do this. And that's why the basic healthcare provision fund is actually being disbursed directly to the health facilities, for the primary healthcare facilities, and also where the state health insurance, they open up accounts. It goes also for the capitation of the, when we say capitation, that means depending on the number of enrollees in the health insurance scheme in a facility, they will actually be given a certain amount. And this capitation is very useful in giving some also capital towards the maintenance of and the upkeep of that facility. So it's very, very important that civil society organizations, community-based organizations, World Health Committees, local government health authorities are put in place, are very much aware that they have a very important role to make this work. And that was the whole essence of that red letter. Which the Honorable Minister of Health, Professor Pate, sent round that, look, this one has gone out. It's now up to citizens to make it work. Many times we keep on blaming, pointing fingers at federal level, the president, for everything. So what the federal government is trying to say is that they've done their part, because actually they have done their part. They've disbursed the funds, and they've even made it known that, oh, hey, we've disbursed these funds, so now it's up to you guys to make sure it works. There's a limit to how much they can be doing in Abuja. This thing affects all of us, and I think it's a very, very good and best practice. Of course, we know Professor Pate is as a global public health expert, so he knows best practices of transparency, accountability, and I think this is a very important step in the right direction.
All right, before we look at accountability and transparency, about 32.9 billion naira has been disbursed. I would have asked, how do we measure past disbursements if we have not even gotten this large tranche of fund? But how are we going to measure success now in order to prevent challenges experienced in the past disbursements?
Well, again, one of the things we need to look at is that all of us have a role to play. They've done their part, and the success of this working is to ensure, one, that there's in each of those facilities, that the availability of drugs, the human resource for health, that means the health workers, they have adequate health workers in place, properly taken care of. There's equipment, and of course that there's maintenance. We have a situation where many of our primary healthcare facilities, there's no running water. Imagine in a primary health facility, there's no water. So some basic things have to happen, and that is why it is key for everyone to ensure that this happens. Of course, from the health insurance gateway, the idea is that the most poor and vulnerable households are meant to be covered. Now, with the National Health Insurance Authority Act 2022, it is mandatory for every resident in Nigeria to be covered by a health insurance scheme. In Lagos State, for instance, of course, we even had before that, in 2015, we were even more progressive. In the 2015 Lagos State Health Management Agency law, we already had the provision that every resident of Lagos State is meant to be covered by a health insurance, either a private health insurance package or a social health insurance, which in Lagos is known as Ilera Eco. So everybody is meant to be covered by health insurance because, as we know, health spend is like 70% out of pocket expense in Nigeria, which is not sustainable. And that's why we see many people who cannot even afford to go for tests, who there's wrong treatment because they cannot, at the point of service, the point of service for health, they will be asked to pay. That is not how sustainable health systems are in place. The sustainable health system must have a support, and the health insurance scheme in Lagos State, the Ilera Eco scheme, is meant to do that. And so one of the key outcomes, success outcomes, is when we make sure we have covered our poor and vulnerable households in Lagos State, that they have a health insurance scheme. And the Basic Health Provision Fund is supposed to support that. In Lagos State, we also have the Equity Fund, which is the Lagos State version of that, which is supposed to take care of the most vulnerable. Also, it's also 1% of the Consolidated Revenue Fund of Lagos State. And it's supposed to take care of the most vulnerable in Lagos State. And I think one of the things that this Basic Healthcare Provision Fund is meant to do is to ensure that there's enough support coming so that we can reach the maximum number of people and no one is left behind. And that's one of the critical things. So the success of outcomes of this is that the most vulnerable persons in Lagos State, persons with disabilities, the elderly, those who, especially those the children, infants, and all, they all have pregnant mothers, they all have coverage, health insurance coverage, either by the Basic Healthcare Provision Fund or the Ilera Eco Health Scheme. So it's something which all of us need to get involved to make sure that this happens. One of the things the Lagos State government is trying to do is gradually trying to make this a condition for various ways of accessing government services, so that you have to to show that you're actually covered by health insurance scheme, for instance, to register in school, to maybe register your vehicle, etc. But it's gradual, because the whole idea is people have to be sensitized. So one of the things that the red letter is doing from the Minister of Health is to let people become aware, and that has brought many people talking that, oh, okay, because many people, it's not something they think about, that there's even that disbursement going around, going out to the primary healthcare facilities. And take note, this is directly to the primary healthcare facilities. It's not going anywhere else. And in fact, the World Health Committee in each facility, a member, chairman, is supposed to be a signatory to their accounts. So now there are no excuses again. No, we can't blame government. Let us now, with this fund, which we have, in each of those 8,000 primary healthcare facilities, let us ensure that the funds that have been sent, and we're aware of, is judicially taken care of. In Lagos State, this disbursement seems it's a total of about over 600 million for Lagos State, 673 million, which makes Lagos State like the 19th in the ranking of disbursements. Other states like Kano is first, they had over 1.6 billion. Katsina, which is about 1.6 billion, was second. Kaduna, Borno, these were the ones that had the highest disbursements, while Lagos State was 19th. Now, part of the challenge we face is that these are some of the advocates we've been making, that for Lagos State, we need to be able to have coherent metrics to measure the poverty level, the vulnerability level, because the kind of indicators they use is such that a lot of the vulnerable, real vulnerable in Lagos State become disqualified because they use such indicators like maybe people having thatched roof, things that are more relevant in the far north than here. So that's why it now appears that, a time back they said the more vulnerable in Lagos, poor in Lagos were just 4%. This is the estimate from federal. Meanwhile, Lagos State, Bureau of Statistics, etc., we use closer to like 60% or so. So see the difference. And Lagos State has an estimated 30 million, over 30 million. Those are the figures Lagos Bureau of Statistics are estimating now. Of course, this is also why we need the census so that we can actually have some more accurate figures. But if we still use it, like the federal uses, they use something that would make our population something like 12 to 16% billion, which is like maybe half of what is reality. And that's why we see that Lagos State gets relatively low disbursements. They also look at IGR, that Lagos State generates a lot of IGR, so that maybe they don't really need that much. So we can see that Lagos State is one that is getting the short end of the stick because of its supposed purported affluence, relative affluence. But they have to always balance it that we have very high population, fastest growing megacity in Africa, and we have people from all over Nigeria, all over West Africa, who come in here and settle on a daily basis and are bringing a strain on the health facility. So the Basic Healthcare Provision Fund indicator, success indicator, will be to ensure that maximum number of vulnerable people have access to basic health care and maximum number of vulnerable people are covered by health insurance scheme.
Sincerely, Barrister Adebusoye, the disparity in funding as well as disbursement is another issue for another day, another topic entirely. I hope we'll have time to discuss that in the future. But let us quickly look at access and functional healthcare systems. What should key players start doing in terms of preventable diseases, vaccine preventable diseases? Are we also considering sorting out this part of preventive care through the funding?
Yes, everything to do with basic health provision, health promotion issues, issues of prevention, they're all there. And even there's emergency response, so which is also to do with the issue of handling pandemics, etc. These are also part of the Basic Healthcare Provision Fund. So now it's for each state to be able to ensure, and of course, that's why each of the facilities, they come up with the annual operational plans and all that, which is what the budget goes into, the funding for the Basic Provision Fund goes into, to ensure that those key areas that are identified by the facility. And of course, and this is where, again, it's so important that the structures which were envisioned by the National Health Act are in place, which is namely that we should have a competent governing board of the primary health care agency. In Lagos, it's known as the primary health care board. There should be a governing board which will bring together all the stakeholders. The local government level, there's supposed to be a local government health authority, which again will be headed by a medical practitioner, and which will have community leaders involved, and of course the medical officer of health will be part of that. And then the ward health committees at the ward level, where they themselves will be able to develop the annual operational plans, their budgets, which will then be sent to the local government health authority with all these priorities, health promotion, prevention, etc. And where they can see, because this thing has to be harmonized, the governance structure has to be in place so that the accountability systems will be effective. Then it's sent to the private healthcare board. So once we can decentralize, because the whole point of this is decentralizing the planning, decentralizing the implementation of health system. And I think it's something which we all have to really push, because it's still in a rudimentary stage, but at least it's moving a little bit. And it needs the citizens. This is something that we need to know, that it is everybody's business. It's not just few people there, either in Abuja or in Alausa. Yeah, it's everybody's business, and especially at the local government community level, the citizens, the community-based organizations Community Development Association, the World Health Committees have to make this happen.
All right, I agree with you that the task before the citizens now at each locality is all about taking ownership. What do you want a specific task from you to citizens now? What do you like citizens should start doing in terms of ensuring accountability and transparency? Because it's not just enough to hear about these big steps for our healthcare systems.
Yes, very important. And a few of them. One is that citizens must demand published expenditure lists at state and facility levels. Who received what for which primary healthcare centers? Now, the Ministry of Health, Federal Ministry of Health, have given the basic big chunks that came to Lagos State and all the states. Lagos State 600 over 600 million. But so now, citizens should demand for at each facility. How much came. Previously, it used to be the estimate was around 100,000 per facility for their costs, their budget. So, and they'll get like every 3 months, so like 300K. But it should be known. Everybody should know. It's not something that you hide. Just like they did at federal, so the states could publish that these are the facilities that received X amount. And for what? So you know that, okay, this facility received this because in their budget, there's something which they're supposed to receive the money for. That's how they'll know which primary healthcare centers or what it's for. And then the civil society and media, this is up to them now, they should track the fund flows and compare outcomes. For instance, are the primary healthcare facilities better stocked? Are there more people insured? You need to track what's the coverage level. Advocacy groups should work with facility health committees, World Health Committees to provide independent oversight. This is where cities do many times. Organizations like Lagos Society Partnership, Public Health Sustainable Acquisition Initiative, and others, they do like independent oversight. Sometimes they even do mystery shoppers. We go to the various facilities just to go and track exactly what's happening at the service delivery level so that we can actually give that independent report. So we should look at the minister's red letter as both a funding release and a call to vigilance. It's so key. Citizens at the state level are expected to track the funds. Let us not push it to anyone else. This is now up to us. We really have to ensure that we actually do what we are meant to do. The federal government are telling us, like the minister, that he's done his part. They've done their part, so it's up to us to do our part.
All right, it is up to us to do our part. We need to be vigilant. We need to take ownership of these healthcare structures around our locality. Barrister Ayo Adebusoye, Chairman, Public Health Sustainable Advocacy Initiative. Thank you so much for sharing your expertise on the recently released 32.9 billion Basic Health Care Provision Fund by the Federal Ministry of Health. Thank you so much for your time.
Thank you very much. Have a good evening.
Good evening. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. We all need to take ownership of the healthcare systems around us. The recently released 32.9 billion naira basic healthcare provision fund is our right, is our own. We need to start saying something when we see something going wrong. We need to ensure accountability and transparency at each healthcare system, primary healthcare systems. If these primary healthcare systems are working, we do not need to stress or overburden the tertiary and secondary healthcare systems around us. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.